Understanding renal embryology and anatomy. Kidney development begins with the pronephros, mesonephros, and metanephros, each serving vital functions. The mesonephros operates as a temporary kidney and contributes to male reproductive structures. The metanephros, the permanent kidney, develops from the ureteric bud and metanephric mesenchyme. The ureteric bud forms essential structures like the ureter, renal pelvis, and collecting ducts. Metanephric mesenchyme gives rise to key nephron components such as glomeruli and tubules. The Potter sequence arises from oligohydramnios, leading to serious developmental issues. The proximal convoluted tubule plays a crucial role in reabsorbing sodium, glucose, and more. The descending limb reabsorbs water only, while the ascending limb handles sodium and chloride. The distal convoluted tubule reabsorbs sodium and chloride, influenced by PTH for calcium reabsorption. In the collecting duct, aldosterone boosts sodium reabsorption, while ADH enhances water reabsorption. GFR is estimated using inulin or creatinine clearance, though creatinine slightly overestimates GFR. Renal plasma flow is calculated via paraminohippuric acid clearance, a key renal function indicator. The filtration fraction, GFR divided by RPF, typically hovers around 20% in healthy kidneys. Clearance rates above GFR indicate secretion, while rates below show reabsorption in nephron functions. Normal blood pH lies between 7.35 and 7.45, with bicarbonate levels ranging from 22 to 28. In metabolic acidosis, we see low pH and bicarbonate levels, often caused by conditions like mud piles. Metabolic alkalosis is marked by high pH and bicarbonate, commonly due to issues like vomiting. Respiratory acidosis occurs from hypoventilation, as in COPD or opioid-related conditions. With respiratory alkalosis, hyperventilation can be triggered by anxiety or high altitudes. Hypokalemia manifests with U waves, while hyperkalemia shows peak T waves, indicating heart risks. Nephritic syndrome features hematuria, hypertension, and declining GFR from causes like post-strep glomerulonephritis. Nephrotic syndrome is characterized by proteinuria over 3.5 grams, edema, and common causes like minimal change disease. Alport syndrome disrupts collagen, leading to hearing and vision problems alongside kidney issues. Fabry disease is an X-linked disorder causing angiokeratomas and ultimately renal failure. Acute tubular necrosis is recognized by muddy brown casts in urine, marking renal distress. Acute interstitial nephritis can be identified by the presence of urine eosinophils amidst kidney inflammation. Nephrocalcinosis typically arises from hypercalcemia or conditions such as medullary sponge kidney. Diuretics target specific nephron sites. Acetazolamide at PCT, loop diuretics in the thick ascending limb. Thiazides inhibit sodium and chloride reabsorption at the distal tubule while boosting calcium retention. Potassium-sparing diuretics like spironolactone operate at the collecting duct to balance potassium levels. Mannitol serves as an osmotic diuretic, promoting water excretion and impacting renal function significantly. ADH antagonists, such as conivaptan, help combat conditions like SIAD by affecting water balance. A crucial takeaway, loop diuretics lead to calcium loss, while thiazides enhance its reabsorption. ACE inhibitors can lead to side effects like hyperkalemia, cough, and angioedema due to their renal effects. NSAIDs affect renal blood flow by constricting the afferent arteriole, altering filtration rates. By dilating the efferent arteriole, ACE inhibitors enhance glomerular filtration pressure. grasping renal embryology and anatomy is essential for understanding kidney functions and related disorders. Study effectively by focusing on the key structures and functions of the renal system. Maintaining kidney health is vital for overall wellness and efficient body function. Renal pharmacology plays a pivotal role in treating kidney diseases and managing electrolyte imbalances. In this video, we reviewed renal embryology, nephron physiology, and pathology, among other topics. Explore more about the fascinating world of renal health and related medical fields. Don't forget to subscribe for more educational content on renal and overall health. Share this video with friends and family to spread knowledge about kidney health. Thank you for joining us in this exploration of renal systems. Until next time.